Yeah, thanks everyone for joining, and we'll get started. Ryan, I'm wondering, can you talk a little bit about how you got started in photography and ended up here in New York?
Yeah, it goes back a few years. I started out because I used to work at a photo lab in California about almost 20 years ago. I had no interest or experience with photography prior to that. And after I started working in the lab, I picked up a camera, started processing my own pictures, and fell very deeply in love. I was a wedding photographer for a long time, and I got burnt out. And about 8 years ago, almost 10 years ago, I got my first assignment for the Fresno Bee, my hometown in Fresno, California. I fell in love with the idea of telling stories of my community. So that was the fundamental shift from going from wedding photography into pursuing journalism. And then about 8 years ago, I decided to move out to New York with no experience or no contacts, and try to become a photojournalist. And I don't know if I would have given that same advice to many people in that same situation. Right. But I was kind of gung-ho enough just to go for it. And everything changed for me, particularly when I took the Missouri Photo Workshop, and I met some incredible mentors, editors, colleagues, photographers who have become very good friends of mine. And through all of those kind of strange connections, that my life in New York journalism started about 7 years ago.
Mm-hmm. And have you been working primarily for the Washington Post, or are you freelancing for a lot of different people?
I mostly work for the New York Times, though my first assignment was for the Washington Post through Chloe Coleman, who was in my Missouri Photo Workshop class. And but yeah, primarily my work is through the Times. Metro editor Jeff Verticella, who we have all worked with, he gave me my first assignment for the Times about 5 years ago, and little bit by little bit, I've been, small assignment, slightly bigger assignment. It takes a long time to kind of, grind it out. So 18 years later, here I am.
Can you talk about, since we've got you on, can you talk for a minute about covering the funeral home, because that was a story that really got a lot of attention, and really, I think, woke people up. The funeral home in Elmhurst, I think it was.
Yeah, there was the Newfield funeral home, who I've seen. They've been very media friendly, and I've seen that a lot of photographers have covered the home in the 2 months since I covered it. I mean, I think that the general public was curious just about what everything felt like behind the scenes. So I got a call from the Post, and we actually tried to it was tough, because it was supposed to be a look at the funeral home, kind of the daily operations, and to tell the story that even though that the COVID deaths were sending the numbers kind of through the roof, that other people in the community were still dying. And so, this community funeral home still had to juggle being a kind of a destination for the community under regular circumstances, but also under these like incredible circumstances. And so their volume went up. Like for the week that I was there, their volume went up from 5 to 7 funerals a week to upwards to 30 a week. So it was an exponential growth in just a matter of a few days.
Right. Can you talk, what were the privacy issues working in there? How difficult was it? It must have been really difficult to approach grieving families and try to get the information that you needed without offending people and crushing people at a really vulnerable time.
Yeah, it was very, very difficult. I had approached 2 families and both said no. That was not ideal. I wish that I would have had more of an opportunity to try to reach out to the family before that particular day. Like I would have researched and reported as much as I could have, so that prior to me showing up, I wouldn't have to confront these families who are grieving. But you know, just because of the logistics of everything, that couldn't quite happen. So I made the ask through the funeral home to make an introduction for me to these families. They both said no. They were, you know, and I tried to keep it as brief and respectful as possible. You know, we still have our jobs to do, and sometimes that it requires asking really difficult and you know, confrontational questions. And that's still, as a person, that's still difficult. But you know, that's so in that respect, we ended up pivoting a little bit more towards focusing on the narrative of the funeral home as a whole, as opposed to these particular funerals that were going on in the home.
Right, right. And let's move for a minute to Desiree. Desiree, you've mostly been doing general assignment stuff also for the New York Times, is that correct?
Yeah.
Uh-huh. And can you talk for a minute about your process? How open are those assignments? Are they giving you a lot of leeway and latitude to go out every day and cover stuff?
Yeah, so yeah, most of my coverage has been general. I predominantly have been covering the Bronx, a bit of Queens as well. Part of general coverage is that we're out searching for features of the themes and topics of that week, but also just how that community or that neighborhood is affected by the pandemic. So when I'm out, I'm looking for, you know, food pantries, essential workers in the neighborhood, also what's happening outside of the hospitals within that neighborhood as well. So yeah, like my process, I'm trying to research what's happening in the community, also what's happening in the news that week. But it is pretty broad, essentially.
Mm-hmm. And I also get the impression that you've been almost living in your car at times to cover this.
Yeah, definitely. You've seen me. I probably wear the same thing on assignment because I'm paranoid of my contaminated clothes. Yeah, like I have been traveling by car, just, you know, just in order for me to travel throughout the Bronx, especially. And yeah.
Can you talk about your safety precautions? Because I know you've been really taking great precautions to not be carrying the virus home or spreading it to other people.
Right. So I wear an N95 mask on top, and then I wear a cloth mask over that every time that I'm out, every time I'm interacting with anyone. I generally stay 6 feet away from people on the street. Of course, washing my hands, crazy. And yeah, like whenever I get home from an assignment, I sort of have a space dedicated to all of my gear and all the things that have been outside. I leave my shoes outside of my door, and I immediately disinfect my gear as soon as I come in, and then I jump in the shower, take everything off, all that. Right.
Has it been emotionally difficult for you to be out every day doing this? I mean, I know you've seen some tough stuff, and I know you've had some troubles trying to photograph some of the hospitals and some of the other stuff. Can you talk about that?
Yeah, I think it definitely like puts a toll on you after seeing, you know, especially in hard hit communities, how the community is affected. Also, you're worried of your own safety too. There was some difficulty photographing outside the hospitals. I think after, you know, some reporting, there was I don't know, it just seemed like security outside of hospitals just increased in their precaution and kind of wanting to avoid the media. So for me, like there was some interaction where they had asked me not to, you know, photograph even if I was on a public sidewalk. So that was a bit difficult, but I think it was important for me to understand that everyone is kind of experiencing the same anxiety and stress right now, and trying to place myself in their shoes and be more understanding of that.
Mm-hmm. Did you feel that what was the reason given? Why were the hospitals trying to stop you from photographing?
I think for them, they you know, they thought that they were protecting, you know, or they were at least attempting to protect the people who were coming in and out of the hospitals, their identities. And yeah, I think it came down to where you just have a conversation with them and just explaining that we're trying to inform the public. Like, for instance, I've been mostly photographing the new walk-in testing centers. So just wanting to cover that story. So it was kind of hard for me to understand at first why they were so, you know, anti-media. They didn't want us around initially. So, but I think after explaining to them, like, you're there not to, you know, impose, and you're just trying to do your job, they were much more understanding.
We're seeing some pictures right now of the NYPD. I know that you spent some time with them. And that's really blown up into a big story because there's an enormous disparity, racial disparity, in who they arrested. I believe 35 of the 40 people arrested this past weekend were Black and African Americans. So did you see that when you were out with them? Did you see disparities or?
No, so for this story, we accompanied 2 officers who were enforcing social distancing. This was in sort of the Lower East Side part of Manhattan, but we didn't experience it. They were mostly like enforcing social distancing outside of like Trader Joe's and, you know, Targets and stuff like that. So very little did they interact with the public, just because I think everyone was sort of doing their part in those parts of Manhattan.
Right.
So yeah, me and the reporter didn't see any of that, but I'm really curious to see if there was going to be any follow-ups in regards to what you just said.
Right. Yeah, I think it was obviously mostly in parts of Brooklyn and the Bronx that this went on, but yeah, it's tough to catch all these things that are going on out there. I mean, it's happening in little corners, but if you're not in the right place, though people today have cell phones. Have you seen any good cell phone footage of this or video footage? I know there was the case on the Lower East Side. I think it was Officer Garcia made an arrest that was, I believe he was suspended.
Yeah, I've been following up. Yeah, seeing some of the videos that were recently posted, and yeah, again, question whether there was going to be a follow-up on this. I know the Times has been doing a lot of reporting.
Gabby, can we come over to you for a minute? Can you talk a little bit about how you got started as a freelancer?
Yeah, so photography for me has been something that I've been interested in since I was a kid. And after graduating from my undergrad, I ended up in marketing. It was like after the financial crisis in 2008. And 4 years ago, I decided that I wanted to give this a go, and decided to go to Columbia, where I got my master's in journalism. And I think it was right before I graduated, Idris Latif from Reuters finally met with me and gave me a contract. And so I started freelancing for Reuters. And it was super fortunate that I was accepted to the New York Portfolio Review, and where I met Jeff also. And I was pretty sure he was punking me, that he was going to send me a contract. But 2 days later, I got an email from him. And that's how I started freelancing for the New York Times. And that also just opened doors to a bunch of other publications who I work for as well.
Right. That's Jeff Furticello?
Yeah. Yeah.
And you've all worked for him, it seems like.
Yeah, him and Andrew, yeah.
Okay. Has he helped in, I mean, how do you feel about him as an editor? I don't mean to call him out.
I think I've been thinking about this a lot. I think there's definitely a difference in generations of editors. And so there was definitely a different culture, I think like 15 or 20 years ago. And I feel really grateful that the editors I work with now are incredibly respectful and really conscientious about us. And very early on, him and Andrew made it very clear that like we all knew this was going to be going on for a long time, and that we definitely had this space to like take time if we needed, because it was very clear this was going to be pretty hard. And some really tragic things were going to unfold.
Have they pressured you to take assignments? Have any of you felt pressure, or has it been totally voluntary?
By editors?
Yeah.
No, not at all.
Yeah, I think they've done really well at being very supportive throughout this whole process.
Right, that's good to hear. And I want to talk about NYCHA in particular, Gabby, because you and I have both, worked there together over a period of years. And, the New York City Housing Authority here in the Bronx in particular, you've got a long-term commitment there. You spent a lot of time, probably hundreds or maybe thousands of hours there working with families. And earlier you said that you completely foresaw, you saw how this was going to hit NYCHA. I mean, if New York City is the epicenter and the Bronx is the epicenter of New York City, then NYCHA is really the epicenter of the Bronx,
Yeah, so I was also like very luckily got accepted into the BDC Claremont project, and there's 12 of us photographing the Bronx. And the premise of the story that I was working on, and the sort of the data point that I was looking at, is that women of color were dying at twice the rate of white women, as white women, from preventable diseases. And as you start sort of diving into public health information, like the Bronx, there's a campaign that's been going on for years called Not 62. And this is the 11th year in a row that the Bronx has had the worst health outcomes of any county in New York City, or in New York State, sorry.
There's 62 counties, I think.
Yeah, so they have come in last in terms of health outcomes for things like asthma, diabetes, hypertension, all of the sort of the comorbidities that have proven to be to make people really vulnerable to COVID-19.
Right.
And so as you look at those things, it was very easy to see very early on who this was going to affect more than others. And your question to Desiree about the policing, I had just come off of the campaign trail where with Bloomberg, a big talking point was the stop and frisk policy. So, knowing how this had affected New York City previously, any kind of policing or policy of policing, we could very easily see who this was going to affect. So I think anybody covering, or, any journalist is not surprised by all of the things we're seeing unfolding in these last few weeks.
Did you, I did some work in NYCHA recently, and just as the time they were starting to shut down the schools, and I was completely shocked at the lack of preparation. I think there's 100,000 people in the Bronx and approximately 500,000 people in New York City living in NYCHA housing, and I saw no preparation, no education, no public health stuff, pretty much zero. Was that your experience also? Yeah,
so Desiree talked a little bit about the general coverage stuff that a lot of us have been photographing. And, very early on, it was sort of hard to sort of pinpoint what stories we were going to work on, because every day, like, there was an explosion of new stories and new things happening, new policies being put into place. And, at least I have been given great leeway to suggesting what kind of issues or places that we might look at. Right. And the New York Times has often just like allowed me to go to the Bronx or wherever I've suggested looking at. And so, very early on, I was in the Bronx a lot and looking at Claremont again. And, we'd walk into the elevator lobby and there's thousands of people living there, as you said, and there's just a little sign like very high above the mailboxes, or, one little sign, and it was from the NYC Health. So it was lots of text. There wasn't a lot of guidance about what you could do to protect yourself. So yeah, I think I definitely saw that too.
Mhm. And what has been the impact on NYCHA? Can you talk about how this is hitting?
Yeah, so I am working on a story now, but so I can't talk too much about it. But you know, I think from all the reporting that's been done already, there's been a lot of people have been lost who have been living in NYCHA.
Mhm.
I can't. I'm not sure I have any numbers on that, but at least in the work that I've been doing, everyone knows somebody who has passed away. And you walk through the buildings, and there are memorials for people who are lost, and so there's definitely a lot of that, and also a lot of fear. But you know, in addition to the health outcomes, there are other disparities. You know, one of my sources for my diabetes story in Claremont early on was talking about how she couldn't get internet access for her daughters to
Right.
do online schooling,
Right.
and through the bureaucracy of NYCHA or through the DOE, like was not able to get the devices that she needed for her kids.
Right.
And this mom is incredibly proactive about her children's education, and was still having a hard time. So I ended up working on a story on that for the New York Times also. Nikita Stewart reported about that. And unfortunately, there's still kids who still don't have devices
Right.
2 months later. So
Yeah. Yeah, I think there's this general impression that has been put out by the powers that be that, you know, everybody has free Wi-Fi and access to Wi-Fi, and all the seniors in our senior photo program almost all of them are cut off. They either don't have computers, don't have Wi-Fi, or don't have either of them.
yeah.
And yeah, it's a tough situation, especially when they're living alone and they're, you know, staying in their apartments for weeks at a time.
Yeah.
Yeah.
And it's also the main way that, I don't know if anyone else has seen this, but it feels like it's the main way the city has been communicating with us about
Right.
information. And so like the 692 or through all of the websites, it feels like that's how you get anything done nowadays.
Right.
So.
Right. Yeah. So if you're not on the web, then you're at a potentially life-threatening disadvantage. It's not a small thing.
Yeah.
Yeah. Victor, you've worked all over the world and, you know, done a lot of stuff in Syria and Iraq and Afghanistan. How does this compare in terms of kind of the devastation that you're seeing and the danger?
Well, it's in some ways, I mean, it's very different, but in some ways it's worse. Like the frustration for, I think, all of us is how do we depict this, like what at least in New York City and soon to follow in the rest of the country is a catastrophic loss of life.
Right.
I mean, we're talking about numbers of people dying that are, you know, like in such a short period of time that is comparable to like the Civil War or something like that, right? Like,
Yeah.
and I'm interested, obviously, up front at trying to communicate that to the rest of the country, to try and help the rest of the country prepare for the inevitability that's coming their way, and also to kind of in some way help us remember and help us count this catastrophic loss that I think we're not really wrapping our minds around yet. I mean, I know I'm not wrapping my mind around it yet. So that's a real, like, a frustration and a drive. And I think in that way it's different. Just the sheer, I'm just real curious about how this is going to tear at the social fabric of our country. Like, what's it going to mean to lose this many people this fast, and especially people who are now, we are well aware, fit a couple of certain demographics that are already marginalized in our society. Clearly racial, ethnic, immigration status, also age, the elderly. We're going to lose, like, we're going to just skim right off the top of a generation that that should have many more years to help inform the ones younger than it, you know? So I'm really curious about that. And I think that that's distinct from usually in a shooting war or in a conflict situation, right? Young men are killing young men, right? You have combatants on both sides. They're shooting each other. They're killing each other. Now, unfortunately, oftentimes a lot of civilians are getting wrapped up in that. And that's a concern for all of us. And that's the real, I think for me, that's the real similarity is I've spent a lot of time outside of trying to cover combatants in conflict situations, in telling the story of civilians who are caught up in the middle of it. And that to me is the real parallel, is that these folks are in some ways civilian casualties. I don't like using the word collateral damage. I think that's kind of a baloney word, but they are people who are caught up in circumstances outside their control, which are being propagated or pushed or mishandled by the people in whom they've placed their trust, their elected representatives.
Right.
The people who are supposed to look out for us are not looking out for us at every level. You know, everybody wants to jump on Trump, but I've been shocked at the ways the city has mismanaged this crisis. I mean, this is New York City, like, you know, one of the most the most capable, most developed, richest city in the world. And I've watched our political leadership, and you know this whole Cuomo for president thing and all this. Like, I mean, when the accounting is done, we're going to see a lack of or a very poor showing at all levels, federal, state, local, and because of that, we have somebody tell me, what are we at today? Are we over 18,000 dead in New York City today? 18,000 people in the city. And there's going to have to be accountability for that, you know, and hopefully, no matter how anybody wants to kind of whitewash or smear over what they have to answer for in this, hopefully our work, our pictures are going to help in that accounting. So that's kind of that's the key thing to me, you know. I mean, there's been a little bit of discussion, and I listened to a radio program about, like, is war the right metaphor for this? Is war the right metaphor? And I don't really know. I think I'm a little agnostic on that. I think it's important to consider. But I'll tell you one thing for certain, is that in the emergency rooms, in the ICUs, among the critical care doctors, they definitely think this is a war. They definitely see it that way. They definitely use that metaphor. They are definitely constantly trying to deploy new tactics, new weapons, whatever they can, knowledge to combating the virus and saving lives. And so inside the places that are hard for us to get into, it is seen as a war. I can say that.
Right. Talking about the statistics and the lack of, I was looking today at Taiwan. Taiwan has the same population as New York State, and they've had six deaths from COVID. That's 6. That's not 60. That's not 600. It's 6, and they've got the same population. I believe Hong Kong, if I'm not mistaken, has had four deaths, and they have the same population as New York City. So it's kind of amazing when we're in the tens of thousands, and they're down in, they haven't even reached the double digits yet. And a lot of that obviously is public health policy and leadership.
Right. I mean, I'm clearly not an epidemiologist, but the truth is that this is the worst place in the world for deaths from this virus, and someone's going to have to. There's a reason for that. It's not because New Yorkers are more sick. It's not because, there's a reason for that, and someone's going to have to answer for that. That's clearly the case. Yeah.
I had a general question. I've really seen a real lack of graphic photos out there. Again, if we are thinking about this as a war or a battle, alerting the public is always a big part of it. I haven't seen really any pictures of dead. I've seen very few pictures of grieving. It almost seems like there's been a bit of a image blackout on really graphic images. Does anybody want to address that or talk about that or argue with me about it?
I think that you are right in that observation. One of the things that I've thought a lot about, so my husband and I were based in Indonesia for several years before we moved here. And I grew up in Singapore and spent a lot of my career in developing markets. I think one thing that I've noticed is the way that we photograph here in the United States is very different than how we photograph outside across the world, and the kind of respect that we're expected to honor. And not saying that it's better or worse. I mean, it's better. I think we definitely pay more respect to people's bodies, depending on who you are still, depending on, whether you're Black or brown or white. But I think that's been a huge thing for me that I've noticed, at least.
You think that the victims are accorded a certain respect and a certain distance here, a certain anonymity that they would not be accorded if they were people overseas.
Yeah, and I mean, even within the US, I think depending on, you know, what your racial or ethnic background is, you're also afforded more respect in terms of when you're suffering or when you're going through issues. I'm not sure if anyone else agrees, but you know, even so, I've been keeping an eye on the reporting out of Asia and specifically Southeast Asia, because that's where my family is. And in Indonesia, you know, there's a lot of stories about the poor management Jakarta and the country has been doing, but I also know that there's incredible acts of resilience that's happening and innovation that we aren't reporting, whereas here the entire narrative has been around the resilience of New Yorkers and the resilience of our healthcare workers and the innovations that are happening with like face shields and 3D masks, 3D printing. So yeah.
Right. But we are approaching I think almost 100,000. You know, we're not that far away from 100,000 deaths, and there is kind of a shocking lack of outrage. I mean, a lot of people are sort of clamoring to get back to normal and clamoring to get back to work, and I wonder if that's because we're not seeing these graphic images.
Well, I think that one of the issues, I agree with Gabriela that there is, there's been a debate kind of, especially in photojournalism over the last few years, right, about how we depict violence and the victims of violence and who we decide to show graphic images of who are when they've been the victims of violence or when they're or after they've been killed. And I think it's a helpful debate. You know, there's some certain terms of that I kind of have an affinity for, and certain terms of that debate that I disagree with. But one of the things that I think Gabrielle is pointing out, and one of the things that I believe very strongly about, is that there's a clear double standard. There's a clear double standard about who we depict as victims of violence. And I think that the way that double standard is coming to bear because the situation is now in our own, in the United States, right? The home of these legacy publications, the home of these powerful media organizations. And I think it stems from a couple of different places, but one of which I think is, to some degree, it's Americans' own very complicated, kind of unhealthy relationship with death. I think that there's a lot of taboos in this country that prevent us, both our readership from engaging with imagery that way, and then cultural taboos that prevent us from even having access, and then also from publishing, right? And this is a debate that is not new. You know, Mike, yourself, you wrote about this exact issue in Iraq, right? About the lack of images of dead and wounded US service members. It was nearly impossible to photograph that. There was a reason for that, and that reason is political. One of the reasons, like my experience in the hospitals I've worked in so far, is the heat. The hospitals aren't necessarily the ones trying to keep us from shooting. So I'm sure Ryan, Gabby, Desiree, we've all done our time outside of the refrigerated trailers, right? Outside of the morgue trailers. Every major hospital in New York City has one, probably two refrigerated morgue trailers outside of it to handle the crush of bodies coming out of the hospitals, right? I think one thing that people don't really realize in all the discussion about ventilators and about supplies is that I don't know exactly what the number is, but I saw a couple different ones, between 86 and 88% of people in New York City who've been ventilated, who have been intubated and are on life support on a ventilator, do not survive. So 86% of the people that we're reading about getting on these ventilators are dying. And that's a huge crush of bodies. So in my experience, the hospitals got these morgue trailers placed outside of them. And then the city, as soon as images started to come out of people in PPE, wheeling people into these trailers, came down on the hospitals hard. And we're like, all right, you got to build a tent, you got to put up a privacy fence, you got to do everything you can to keep anyone from seeing this. And I'm sure in some hospitals it was voluntary. I'm sure hospitals have different outlooks on how they should, screen this from the public. But I know for a fact that the city has come down on hospitals as well. And the kind of cliche that you often hear is this idea of dignity and death, right? This idea of dignity and death, that we have to, that if we show body bags, or let alone if we show the faces or the damaged bodies of individuals, then we are not according dignity to those people. My question is, what kind of dignity is there in a death from circumstances outside of your control where no one is held accountable for it.
Right.
I don't believe
Right.
that that's a death with dignity. I don't believe
Right.
that serves the public. And I don't believe that the people who are the victims of this wish that that were the case. You know, all of us, you know, being photographed and being turned into an icon of a news situation, you know, it's not the best outcome. It's not the best situation, but it's not worse than dying from a terrible disease because your political leadership failed you. And I think that is one of the places we're getting pushback on that. Now, of course, there's a double standard. Of course, Black and brown folks are much easier for largely white audiences to consume imagery of, right? I can show photographs of dead Afghan civilians all day, but like you said, Mike, and as Gabby pointed out, there are very few images of well-to-do white people of their COVID ravaged bodies. And unfortunately, that dearth of imagery is having an impact on the political debate in this country. People are gathering outside of state houses with long guns, trying to force open their economies because they do not understand what's at stake here. And, you know, like I've been scrambling very hard to tell these stories, to try to get them into the newspaper, to communicate that. The New York Times has the greatest reach of any news media organization, that, at least print news media organization in the country, and all of us, all four of us, are trying hard to leverage that to get this information out. But I think that it's a real double standard that we have to face up to, and I think we have as I said before, I think we have a dysfunctional relationship with death in this country that this is going to force a reckoning with.
Right.
Can
right.
I check?
Yeah, please, Ryan.
I agree 100% with everything that Vic and Gabby have said. I do want to just mention briefly, like, there is very clearly a double standard, and part of that double standard is an extension of access to these bodies and to these faces and to this death. The incredible privacy and HIPAA laws that exist within these hospitals. I know that Vic has dealt with this a lot. I've dealt with this on a handful of assignments that haven't been published yet. But, you know, trying to get the permission from the hospital, number one, and then from the families of the patients who are being ravaged by COVID, that makes it unbelievably difficult. And two incredible barriers to visualizing this, given the political atmosphere. You know, HIPAA laws don't exist, you know, when Vic is photographing, you know, dead bodies in Afghanistan. And so, you know, we can sidestep that. It's a lot harder to sidestep that here, when the access to those hospitals, the access to the medical facilities, to the nursing homes, to the places where people are dying. We're putting a greater, you know, I mean, privacy is of course important, but showing this as a pandemic that is affecting literally hundreds of thousands of people, moving into the millions of people, you know, there needs to be some sort of greater conversation about, you know, and this is not just about indemnifying hospitals. This is not just about, you know, getting hospitals off the hook because of lawsuits. Like, what is our moral responsibility for documenting this?
And historical responsibility.
100%. I'm working on a story right now that I can't talk about it, but the levels and barriers to photographing the reality of this situation is proving unbelievably difficult. And this is with the full resources of the New York Times and the New York Times legal staff and the institutional you know, gravitas of the New York Times, let alone like these community newspapers who are these communities who are being ravaged on a local and a regional level, who perhaps don't have that type of institutional gravitas to photograph and tell these stories. Like, you know, we need to ask these questions in a very real way about where do we value privacy versus reality versus, like, in this pandemic. I don't have the questions to that, but these are the questions that we need to be asking. Sorry, Gabby, go ahead.
No, I think that to piggyback off of what you said, you know, we here in the US, I think we really believe in this idea of freedom, and we tout this idea of freedom of speech and freedom of press, but all of our public institutions are probably some of the most opaque institutions that I've ever tried to access. And even for really benign things, like, you know, I had an incredible discussion with somebody at a school where they're giving out food to people. And, you know, in front of my own building, there's a block three blocks long, or a line 3 blocks long, people waiting to get food. And, you know, a lot of New Yorkers still don't know that anybody can walk up to a public school to get food and meals, but somehow I was not allowed to photograph this, even though no one was going to look bad. And so even in very benign situations, I feel like there's an opacity and in a lot of ways, like a barrier to freedom of speech and freedom of press here that I don't think that a lot of people realize.
Right. Yeah, that's a pretty extraordinary anecdote in the middle of the greatest public health emergency, certainly of my lifetime. Yeah. Desiree, you're originally from Texas, and I wonder, have you been following the coverage from Texas, and how have you seen it covered differently in Texas than you are seeing in New York City? Do you know?
Well, yeah. I mean, I think obviously we've seen what's happening outside the state capitol in Texas, and you know, I've been following the coverage, but also just hearing from all my family still live out there, and kind of speaking to what you said earlier about how, because we don't have access to show these types of images, it's hard for people to understand why it's important to stay home. And as we can see, like, you know, most of the businesses have now opened in Texas. And yeah, like I think
Texas was a hotbed, one of the places where people were coming and demanding to reopen, and sometimes even armed citizens were coming and demanding to reopen the businesses. Is that correct?
Yeah.
Yeah. And I imagine the Chronicle is covering that, and you know, the Dallas Morning News and all.
Yeah, and even, you know, the New York Times has also covered some features out there, kind of how, citizens want their businesses open. You see how they're when they're gone, they want, you know, they're demanding what they want.
Right. Yeah, extraordinary.
I grew up in an area not too far from Ryan, and, you know, in the county in California where I grew up, it's very rural, and the number of cases of COVID themselves have been very low, and the deaths there's none. And, you know, I think another thing that is happening is there's been a great economic strain on families and communities. And one of the things that I definitely wish we saw reported more on, and, you know, for myself included, is the failure of government to fill this gap. And we're talking a lot about the health outcomes, because that's the immediate crisis, but the secondary crisis is a very real one too. And, you know, 2 months after, 3 months after people haven't been working, there's still people calling daily to try to get their unemployment checks. And, you know, and if you're not getting that, then what are your options, you know? And I think that there are some valid claims and valid arguments to be made, and also, again, people who to be held accountable, so that people can stay home. So yeah, I think there's that.
You're talking about people in the heartland going hungry, losing their businesses, losing their life's work. Yeah, and that must be terrifying. So I don't mean to belittle them at all, you know, especially if you're in a rural area and you don't see people dying, but you see everything shut down. It must be incredibly frustrating.
Yeah, and you wonder where your next meal are coming from. And we're seeing that here, but that is also what everyone across the country is experiencing as well. So.
Yeah. Does anybody have any safety tips for any of the photographers out there that may be covering this or may want to cover this?
Ryan, I want to hear about your decon lamp. I'm gonna make Ross make me one.
So, I mean, I talked with Vic about this a couple weeks ago about whether or not UV light actually helps or sunlight helps or what actually neutralizes or, these, and I don't know, I read a study that said that a certain amount of UV light is effective in destroying a particular, bacteria or whatever. I have this UV light at home for my plants. And I was like, I'm gonna give it a shot. Like it can't hurt. And this was actually before, before the publication started, giving a lot of PPE. So I really only had a couple masks to recycle. And I was like, well, I don't think this can hurt. And then I talked to Vic and he was like, don't put it in the sun. I was like, oh crap. Like, does this hurt? So I don't know. And I think we're still figuring out like how all of these little things actually manifest.
Right.
I think that we have, by working for the Times, we've all had, enough PPE to keep us safe while we're out in the field. But for those first couple of weeks, it was a little touch and go. So I am no longer doing the UV lights. If anyone has any specific information about the effectiveness of that, I would be happy to hear.
Right.
I want to make a plug just real quick for, and I said, I think the most important thing, and if there's like freelance photographers out there or something that are going to be in a situation, I can only say, please, if you have questions, reach out to me. Like I'm sure Ryan would talk to you too. Ryan talked to me. I talk to people. That's how we keep each other safe. Bottom line, like we got to keep each other safe. And like we could sit on here and talk about, Desiree gave a really good description of her kind of protocol every day, which is, I'm sure, very similar to what all of us are doing. Her sounds a little tighter than mine. I might have to tighten it up a little bit, but I think the key thing, and I think everybody would agree with me, is consistency. If you're going to be out on the street, if you're going to be working, come up with what works for you, but you got to be consistent. And I think that like complacency kills. Like getting complacent in this is when someone's going to slip up. All of us go out on the street. We all interact with people. In New York, the virus is ubiquitous. I am working in, and I think maybe some other folks are too, but their stories haven't come out yet. In ICU rooms, I'm photographing procedures where I am literally being covered in COVID. Like there's no question about it, right? And it's that having that consistent approach to staying safe. And I mean, it's very much like a there, but for the grace of God, go I type situation, right? But I think the thing to stress for folks is consistency. Figure out what you do and do it each time the same way over and over again.
Right.
Also, like I've had photographers reach out to me asking kind of what I'm doing to take precaution. And I, again, give them sort of my sort of routine while covering the pandemic. But I've also emphasized how I don't go out unless I am on assignment too. Go out photographing unless I am on assignment, which I think is really important for people to understand too.
You don't take any chances unless you absolutely have to.
Yeah, I think also I think everyone has this sort of urge to, document what's happening in their communities, what's happening outside. So some of the advice that I've given to other photographers is also just to document what's happening to them personally, not only to keep themselves safe, but keep the community safe as well.
Right. Are there any projects that any of you have seen out there that you really loved? Any photo coverage could be, a different paper, a different photographer, a long-term project, a short-term project. Does anything jump out at you?
Yeah, I'd like to shout out something that was a big inspiration for a lot of us was Eugene Richards on his Instagram feed recently put up another of his short films that incorporated work from his kind of legendary book, The Knife and Gun Club from the 1980s, and new work he shot in recent years in emergency rooms. And I know my buddy Phil and I talked a lot about how much inspiration we were drawing from the book, and seeing his new work over the last little bit, the last few years, kind of was like, oh wow, this is This is who's setting the bar for us, and how do we take lessons from his way of seeing. I mean, nobody can recreate it, but we can do our best to use that as our kind of our North Star. So that's been super inspirational for me working in the hospitals.
Yeah, he's kind of the godfather of modern documentary photography. And the Knife and Gun Club. Do you happen to know his Instagram offhand?
I think it's just Eugene. Is it Eugene Richards' photo? John just had it up there.
Okay.
I think it's Eugene Richards. I think it's just Eugene Richards. Let me check.
Gabby or Desiree, have you seen anything that you really liked?
Yeah, I think one of the things I've been really enjoying a lot of these at-home projects or very personal projects. And, I think in general, our industry suffers from a pretty singular view. Diversity has been a huge topic in terms of who's photographing. And it's been really refreshing to watch the Women Photograph Journal. It's called WP Journal. And since like 400 female photographers have been creating work, mothers, students all across the world. And there are a few others that, COVID LATAM, I think, is one other one, that there's just it's nice to sort of look at a variety of different points of view as well. Right.
Yeah. This is the WP Journal. Right. It's a completely different point of view than you typically see in news photos. Yeah.
Yeah, I would give a second to the COVID LATAM. There's a lot of friends of mine are part of that. Rodrigo Abd and Daniela Volpe and a lot of great photographers in Latin America. And I think that they are, Gabriela's right. It's a different view, but they're also, those of us who've worked in Latin America feel a special kind of, I think, fear and trepidation for when this virus hits that region full force. And they are providing a really valuable preview to what's at stake in Latin America. So I would really encourage people to follow COVID LATAM.
Yeah, and it seems like cases are starting to spike in Mexico now. And I mean, Mexico City has 20 million people. So I can only imagine what we're going to be looking at in a couple of weeks. Hopefully I'm wrong.
I think it's going to be really interesting. I mean, to your point of Mexico, the stat came out that a bunch of numbers were hidden and they got leaked. And I think that it's going to be this is a really interesting test for how governments exercise power during these vulnerable positions. So I think it's really important for us to take a look at these countries that have been unstable historically and watch how the journalists and how the storytellers in those communities are witnessing their government's reaction to this thing, because it's going to say an awful lot about power, and it says an awful lot about the way that, just like Vic said, the way that our leadership is dealing with it on a state and national level. So I'm very curious about the long-standing kind of socio-political circumstances that evolve out of this thing, where the acute deaths, the acute illnesses are one thing, but then the deaths of despair that are going to happen after this, where people are falling into economic and social distress. This is going to be, this is going to affect like the next generation of humanity, like, at the very least. And as storytellers, we need to pay really, really close attention to this.
Absolutely.
And COVID LATAM is like perfect for that.
Yeah, doing an incredible job. I also wonder, I don't know if any of you have followed El Salvador, because they've got a really young, dynamic president. And I think it was months ago that he was already shutting down the country and saying, we're going to feed everybody. Nobody's going to get kicked out of their houses. I mean, he was, I would say, months ahead of where the United States was on this. And he's been doing really, really interesting stuff.
That's true, except Bukele has also got a very serious authoritarian streak. In fact, he shut down the National Assembly in El Salvador before all this happened. He's got, for those of us who follow El Fado, the work of El Fado, the digital, the online publication El Salvador, they're all over Bukele and really taking him to task for some of his.
Do you think he's going to use this as an excuse or as a?
certainly he did last week, where they published all those photographs from inside the prisons of all the maneros, the gang members, stacked together almost like they were in concentration camps with zero social distancing. The government put those photographs out. Clearly he's using this as and trying to burnish his image, but also, as Ryan pointed out, as an opportunity to kind of in a country that fits Ryan's description, an extremely unstable country, of flexing his authoritarian streak a little bit. And Ryan's right. And one of the things I would say too is, like, you know, look, as we all know, like, one of the things we can do as journalists and as consumers of journalism is to, in the small ways we can, even if it's just colleague to colleague, but also in the broader conversation, is back up our colleagues who are trying to reveal types of situations in these countries. Back up our colleagues, because they face, I mean, I'm sympathetic to Desiree, and I know we've all gotten shouted at outside of hospitals. We've all gotten shouted at for making a picture. And sometimes, like Desiree said, it behooves us to recognize people's own, what people are going through in that moment as well. Sometimes there's time for a civics lesson, where you're like, well, actually what I'm doing is about the most constitutionally protected activity I could be doing right now, but thank you very much for your concern. But then at the same time, also, it's important for us to like help out these other, you know, shine on our colleagues and and give whatever support we can as individuals to the course, you know, to helping journalism in these contexts, in these individual contexts, not just survive, but because they're facing it a lot harder than we are. Like, we're getting shouted outside of a hospital. Man, when Alfaro published the story, Oscar Martinez and those guys, they fly him out of the country for 2 weeks. Like, they get it a lot harder than we do, and we gotta recognize that.
For those who can't leave, who that's their home. Yeah.
Certainly.
Yeah, and it's fascinating to, you know, when I grew up, if you saw coverage of Latin America, it was, you know, unfortunately, a bunch of gringos like going down for a week and covering it. But it's amazing to see just an incredible, you know, Latino and Latina press corps down there, completely dominating and leading the way. It's wonderful, but at great risk for themselves, obviously.
Yeah, for sure.
I wonder if we should open it up to some questions from some of our followers who are out there. I'm sure they've got good things to ask about. John, I'm sorry. John is the moderator here. John, I'm having trouble seeing questions.
Sure, it should be on the right side of the screen. I'll read one for you just to get it started.
Great.
Can you talk a little bit more about your overall coverage when shooting and how you stay motivated?
Was that addressed to anybody in particular, John, or was it just a general question?
In general, yes.
Does anybody want to grab that? Des,
I would love to hear. I'd love to hear from Desiree, because her general coverage has been fire, and I find myself struggling to do feature hunting around the city, and every time I see one of Desiree's pictures come up, I'm like, yep, I couldn't have made that photo.
Right.
Thank you, Ryan. No, yeah. So sorry, the question was how do I stay motivated, or?
Yeah.
I mean, the good thing, I'm, you know, based here in the Bronx. I teach at the Bronx Documentary Center. So I think for me, it's important to figure out how it's specifically the community. And again, I do that by researching exactly what's happening in the community. Like, if it's food insecurity, where are those food pantries? And staying motivated, I don't know. I find sort of, it's like a hit or miss with general coverage. I feel like I get really excited going out there, but at the same time, obviously taking precaution. And I don't know. Sorry. I'm trying to think of how I stay motivated, because I literally just came back from doing general coverage. So I'm a little bit tired right now. Sorry. So, yeah, I think, like, For me, especially like obviously at a safe distance, I'm engaging with the community too, trying to figure out what they feel about like what's not being covered right now. How do they feel like their community is being represented right now in the media? Obviously, I look for businesses that are closed down, especially like places in the hub where that place is always thriving, and now it's just totally like one or two people are
Right.
walking past. Down Third Ave, and trying to like always try to get an emotional reaction out of the audience when looking at an image like that too is always a goal of mine. Yeah, I don't know if I did that.
Absolutely. Absolutely.
But you also talked earlier about feeling a real, Desiree, you also talked earlier about feeling a real kind of obligation to cover the hardest hit communities, you know, and not just show the Upper West Side or you know, Manhattan.
Yeah, so like for example, Morrisania was a very hard hit community. So the day that I was assigned one day to cover the Bronx, I covered Morrisania, and I particularly set out to photograph the first walk-in testing center at Gotham Hospital. And again, like I photographed the walk-in testing center. There was a long line that was happening, but also it was interesting for me to be out, you know, just, you know, even close to Jerome Ave and other places, like hearing that a lot of the community members had no idea that there was a walk-in testing center, and then hearing their experiences of, you know, we know in the Bronx, like there was the testing center that was at Lehman Hospital or Lehman College, and a lot of the residents in the Bronx don't have a car. So I spoke to family members whose moms were sick, but they couldn't find a car to take them to go get tested, and just like hearing about that. So I think for me, it was like an obligation. Like I wanted to go out the day I knew that that testing center was open. I wanted to go and I wanted to photograph that in order for it to be published and hopefully get some information out there to the community.
Right, right. That's what journalism is about. Yeah, it makes a difference. It can save a life. Yeah.
On a personal level, I think like collectively as a city, it's 7 o'clock right now, so we're hearing everyone cheering, but I think collectively as a city, we're all experiencing sort of a loss of self and a loss of purpose. And I think sometimes this work can provide that. So like if I don't photograph for a few days, I start to feel this like anxiety of like, oh my God, am I not doing enough? Am I not reporting enough? Am I not working hard enough? Am I not researching enough? So I think it's like both a commitment to the community, but then also selfishly, like there is a sense of calm that you experience when you're working towards something.
Right. It does. It is good to have a purpose in the midst of such a horrible crisis, rather than to be trapped at home. It's incredibly frustrating, and I wish I was out there more with you guys. We've got another question from one of our listeners. What stories or voices do you think are missing from the coverage? Do you see any real gaps in the coverage that we're not hearing?
Well, I think one of the things that's missing is and that folks have pointed out thus far, is the voices of families, right? Like I think that, you know, that some publications in the Times especially has tried to start doing kind of like these extended COVID obituaries and try to hear from folks, but I don't think we've heard enough from families about the struggles that they're going through. We hear a lot about the frontline workers and their perspectives, which is super important, especially healthcare workers, which are very important for us, seeing as most of us can't get access to the hospitals and we can't see that up front. But I think we're missing the voices of families, and I want to see more reporting on this social fabric, on what it means to lose this many people. I kind of commented on that earlier. And then of course, you know, like everybody said, I think that I think we all know, and I'm sure all four of us are preparing for, like, you know, my buddy Andrew, North Carolina, we were talking about this one day, and he was like, man, if you thought season 1 was crazy, wait for season 2. Like the economic depression that is coming behind all of this is going to be devastating, and it's going to last a lot longer than the pandemic will. And I think that all of us are starting to kind of, I mean, I know I'm having these conversations with my colleagues about like, what's going to be next? Like, how are we going to position ourselves to be the Dorothea Langs of what happens after this, right? Where are we going to stand? Where are we going to move, physically move, and they will be in a position to depict that. So I think that that's coming. I think we're doing an okay job of it now, but I'd like to hear more, kind of as Desiree was pointing out about like how it's affecting the communities. You know, what are their needs that aren't being addressed?
Right. Yeah, I'm curious about, you know, I mean, we're really losing a generation, as you said earlier, of, you know, our oldest, wisest, most experienced people. You know, many of them who are still like, you know, at the peaks of their creative lives, training and guiding and educating. And I can't even begin to imagine what effect that's going to have as we move forward.
The effect on education too.
Say that again?
Oh, sorry. I said, and the effect on education too, and what that's going to look like.
Absolutely.
Yeah, I think to Desiree's point, we've talked a lot about, you know, and a lot of this is access too, but we talk a lot about adults, and there is an entire generation of children experiencing this, you know, and what is it going to be like to grow up with this trauma and with so much loss at such a young age.
Right. It's also shaping up, you know, originally I was hearing that the schools and businesses might be closed for a few weeks or a month, and then it became the school year, and then it became the summer, and now people are talking about, you know, into next fall. And it really seems like 2020 is going to be almost a lost year. It's just going to be like a year out of history that just vanished, you know, for a lot of people, where they got nothing done and they didn't go to their graduations and they weren't able to pursue the things they loved. And yeah, it's tragic. We've got another question here. How do you assess the risk of an assignment? And are there assignments that you've turned down because they were too risky?
I was assigned to very early in this. I was assigned to photograph a barber doing house calls, and I was a little trepidatious about it. And the publication wasn't giving PPE, and so I was like, all right. So I had to set the rules. Unfortunately, I had to tell the editor, okay, I will do this. I will provide my own PPE, but I will be in there for 5 minutes. I'm not going to spend any longer in that space to greater expose the people in there to me and those people to myself. I will be in there for 5 minutes, and I'm getting the hell out. And so I did. I went in and I made pictures, the best pictures I could in 5 minutes, and I filed, and we got the story. But I think that we really need to. I mean, listen, I feel very fortunate that I'm, you know, getting work. I know that we all feel very fortunate that we're getting work, and you know, and to be in a position to finally where we kind of have a little bit of control, but we have, you know, we need to stand up for ourselves. Like, this is our health, and this work is this work is important, but it's, you know, many freelancers are put in the position where like, oh God, if I don't take this assignment, then I'm never going to get called again, or like I'm going to piss off this publication or this and that. And
Exactly.
You know, it does make it complicated, but I do think that, you know, kind of standing up for yourself and protecting your own health, your own mental health during this crisis is tremendously important. And you know what? There are always going to be crappy editors. There are always going to be people who consider you a commodity, and someone, you know, who can be easily replaced with someone else. And you know what? Pretty early on in this, I told myself, I'm not going to work for those people. That's not worth it for me. And so, you know, you asked Gabby how Jeff was, you know, and Jeff has assigned all of us here. And, you know, I know that I can speak from my own experience that he's been like he's been thoughtful and caring, and he tells us when to take a break when we need it. And he's like, hey, if you ever feel unsafe in a space, just like get out. It's fine. Like, it's like the picture isn't worth it. And so it's nice to have that kind of support from an editor. And
yeah, it's the kind of editors we need.
Feel like, so
Absolutely.
just this week Cuomo announced that he's mandating that hospitals have like 90 days of PPE, and it was a little shocking to me to know that publications around the world were covering this in China and didn't prepare themselves or create the protocol institutionally, when I know as journalists we see things folding on a macro level. But there's been some nonprofits that have reached out with making their way through databases of like Women Photograph and Diversify, offering paltry sums of money to go do ridiculous things, or editors reaching out for you to go photograph on spec. And those are definitely kinds of assignments that I usually turn down. Yeah.
So go shoot it, put your life at risk for free, and then maybe we'll use it.
Yeah. Hell no.
Insane.
I think one thing that's important to kind of consider is that part of the question was about how do you assess risk, right? Risk assessment and risk mitigation are like important tools for photojournalists to develop, right? Most of our day-to-day work that we do, most of our like shooting features for the newspaper or shooting portraits for whoever we shoot portraits for, that doesn't figure into it so much. But this crisis has forced a lot of photographers who don't have experience taking those kind of considerations into account, are having to kind of do it kind of quickly. And I hope that if you're in that position, if you're watching this and you're in that position and you're trying to figure out how to do it, that there's a lot of great resources, the DART Center, Reporters Without Borders. There's a lot of great resources out there to get thinking about this kind of stuff. But the best resource, I believe, is your colleagues. Like, me and Ryan have talked about safety issues. I've talked with a bunch of photographer friends of mine about safety issues. Photographers who are wondering about if they should take assignments or not are calling me up. And I think that one of the things I tell everybody is I think it's very, very important to have a very clear understanding of what your tolerance for risk is. Like when you get out of bed in the morning, what's your tolerance for risk? And not everybody's is the same, and that's good. The good thing is to know what yours is, right? And have a clear understanding of what yours is. And then also, like, the truth of the matter is, like, everybody on this call has demonstrated this, like, we're in the middle of the worst public health crisis in 100 years.
Exactly.
Hundreds of thousands of people are dying from this. A lot of us are getting hired to do this general coverage by Jeff, who backs us 100%, who looks out for us, who collaborates with us. But in a lot of ways, we are the eyes out on the street, right? Even most reporters are manning the phone, working the phones and working from home. Like,
Exactly.
We're getting hired to be the eyes on the street. And I'll just say
for millions of people.
For millions of people. And this is a moment for, and it's super important, Ryan pointed this out, it's super important to also be keeping tabs on, to be aware of. People do this in different ways, but to keep tabs on your own resiliency and your own mental health and where you're at with things. Again, photographers who haven't dealt with this kind of stuff before might not have a process in place, or at least one they can identify. This is what I do. I play with my dog, or I call my mom, or what, me, every time I leave the hospital and it's been a real rough day, I end up texting my mom. I text my mom and say, I love you, Mom. And I think she kind of knows a little bit like what's going on with me, right? That I'm doing it for me. Like I'm doing it. This is part of my mental health check-in, right? And I have other things I do, but the key thing is knowing what those are and having a little bit of a plan. And then, look, this is a moment for daring. This is a moment where photojournalism is proving its worth to the world. I think that it is proving its worth, but it's a moment for daring. It's a moment where not everybody has to, but some of us need to take some risks because the stakes are too high. The stakes are too high to not, and I think that definitely everybody that we're having this conversation with right now got into this because they understand and they believe in the mission of photojournalism. And that does not come without risk. Like it does not come without without taking chances. And they got to be calculated chances. They got to be calculated risks, and they got to be ones that you feel comfortable with. I mean, because any of us could get this, and you are risking your life, to different degrees on different days. But it's a moment for daring in photojournalism, and I'm amazed and I'm heartened every day when I see these colleagues' pictures in the newspaper. I see my other colleagues who aren't working in the newspaper, and I see their stuff published other places. Our buddy John Moore, I don't even want to go. The list of people is too great. People from San Francisco Chronicle and buddy Marcus Yam at the LA Times. People who are out there like running these risks and doing it because they believe in something kind of bigger than themselves. And I think this is a moment in photojournalism where we step up and show that.
Yeah, I couldn't agree more.
In terms of like a just practical thing, I think whatever assignment I walk into, I plan one step up, and assuming that the risk is gonna increase. And there's been times people are like, don't enter this space, and then like this person's house, but then you're in an elevator with them, so you should have been wearing your N95 the whole time and not just a surgical mask. So I think that's just like a small little example, but I think planning up is really important too.
From a safety perspective.
Yeah.
Right. Yeah. Absolutely. Let's take just one or two more questions. Considering the importance of a deeper purpose in reporting the crisis, which do you think plays a stronger hand, facts or emotions? And how do you articulate this? It's a somewhat complex question, but
that's a good question.
It's a great and very complex question.
I think facts are having a moment again, finally. I think there's some people who less than others, but I think a lot of us were very disillusioned by how little facts mattered for a long time.
Right.
So I think that is definitely important. But yeah, maybe to your point about the graphic images, that's something we might be feeling on a little bit now. I don't know.
Yeah, it felt like we were an entire nation moving away from sort of fact-based conversations for many, many years, and moving into, the firm realm of conspiracies on all levels. And I've just watched that mushroom over the last decade. So it's fascinating that people want really good, solid information for a change.
Not that there isn't a plethora of conspiracy theories going on, but
no shortage.
Yeah.
I do think that there is an issue also of kind of juxtaposing the personal versus the abstract. Like for a lot of cities that are not New York, this is it's an abstract idea because they don't know how people have been affected because they haven't seen it in their own communities. And so in this respect, like that's a very personal thing. And I think that once it becomes more personal, it's going to inherently become more emotional for people. And then so this juxtaposition between
between facts and emotions.
Between facts and emotion, it's a complicated one. And for the places that it's being affected, for a place like New York, where facts and emotion overlie and they live in the same geography, it makes it easier for us to kind of make sense of it. But for these places, who do have, 30 cases and maybe 5 hospitalizations, it is an abstract problem. But the problem is, like Vic said, is like just wait for this second act that's going to happen. What's going to be the next New York? Like I don't like I hate like even framing it in that respect. But this is going to affect cities in the way that it affected New York, not to the scale, obviously, because of our population density, but it's going to affect, the interior of the United States. Unfortunately, that's when things are going to be real for people.
Right, and there's no reason that it couldn't affect tens of thousands of people in Indianapolis or Kansas City or Topeka.
Exactly.
Yeah. I'm sorry, Gabby.
One of the things I've been grappling with is, after 9/11, we as a nation banded together and understood that I felt like we understood that there was a personal attack on us, and we felt like that. And somehow with the disparity in deaths that we're experiencing here in New York, one of the things I don't understand is why the rest of the country isn't absorbing it, because, I agree with Ryan. I think that because people haven't experienced this, they weren't living for weeks with sirens going on the whole entire day and night. It is very visceral for us, but I think there were other situations where it was a lot easier for people to digest the threat, or pretend, or, the threat, whatever that was.
Right. But I would also suggest, there's a couple of things at play. One is that increasingly, we've spent really much of the last 10 years splitting the country between the coasts, California and New York, which is actually where the big outbreaks were, and sort of the rest of the country, and kind of creating this us versus them thing, which I think has been a disaster. And I think, we may be seeing that in a way we didn't see that after 9/11, where what I saw was people saying, we want to come together and we want to help you, or people coming to New York and traveling. But I got to say, there have been healthcare workers that have come and literally given their lives from the middle of the country, come and volunteered in New York City, which is just incredibly powerful and touching.
Yeah, to your point, the entire country has been buckling down for several weeks, and it's going to experiencing this in its own way. But something I think about.
Gabby, I agree with you. I think I've been having this conversation with friends too, is I've been kind of shocked a little bit at the lack of solidarity with New York City, right?
Really?
Like after 9/11, it was we're all New York, NYPD,
100%.
everything, FDNY. And I think Mike hit the nail on the head that this 10 years of political polarization we've had is one of the things that's affecting that, right? But like, where are the folks at the Open Up the Country rallies with NYPD and FDNY paraphernalia on? Where are the claims that we're all New York or New York strong? Like, I think it's a sad. I think it's emblematic of how the politics of the last 10 years have left us really vulnerable to this pandemic.
And New York and California are also where the immigrants are concentrated.
It's also hard to swallow because you don't want anyone to experience this, like, this is really horrible. This sucks. I don't want someone to have to experience this ever, to believe it, or,
Exactly.
I think we're going to wrap it up there, but I really cannot thank you and commend you enough, because it's, it would be a lot easier for all of you to stay home and just wait it out, but you're out there, you're putting your lives on the line, and you're the ears and eyes for all the people that can't go out. So many thanks. Victor, Ryan, Desiree, and Gabby, thank you so much for joining us.
Thank you, guys.
I think, and I want to say something I know that there's a lot of photographers watching out there who maybe we didn't get to their question. And like Vic mentioned earlier, we are a community. I feel like I've really been able to stay sane because I've been able to have conversations with my friends out in the field and my colleagues out in the field. So if anyone has questions out there that we didn't quite get to, or you want to know something specific about, our PPE or the story or just general approach or mental health or anything, like reach out to us. Like, I'm Ryan Christopher Jones on Instagram. Send me an email. It doesn't matter. Like, if I'm available, I'm always happy to talk.
Beautiful. And the Bronx Documentary Center has always been a resource for photographers. So you can send an email to info@bronxdoc.org, and we'll refer your question on, and we'll try to get you an answer or whatever it is that you need.
Thanks, Mike.
Thank you,
Mike.
guys. Thank you so much.
Yeah.
All right.
Great job.
We
Thank you.
appreciate you.
All right. We'll talk again.